How are you? Most welcome. Today I want to discuss about painkillers. Well, when somebody is afflicted with arthritis, most people, the complaint they have is basically inflammation and pain. And basically, the first thing that you do when you see your healthcare practitioner is to demand for a relief. Well, I appreciate that painkillers, anti-inflammatories are doing a good job, but at the same time, I will describe them as a double-edged sword, because one thing is you'll get the relief of the pain, but at the same time, it will give you a false feeling that you are cured from your problem when the pain subsides, and you'll do some extraordinary things whereby somebody who is actually suffering from arthritis with the bone joints rubbing against one another could not have done. So I will describe painkillers and anti-inflammatories as a double-edged sword. So I also believe that the painkillers and the anti-inflammatories have done us more harm than good, because if your bone joints are rubbing against one another and chewing one another, if you stopped moving, it basically means that actually the bones will not rub against one another, and the rate of deformity will be reduced. But if you start moving normally while your joints are abnormal, it basically means your motion is creating more damage to your joint, because you are under a false feeling of no pain through the anti-inflammatories and painkillers. It's just like somebody who has got a hole, say, in your teeth. If your tooth is paining and you get an anesthetic injected, of course the pain will not be there. So you'll feel relieved, but the hole is still there. It has not been dealt with. So with arthritis also, when you take painkillers or anti-inflammatories, we can walk miles and miles, we can run 100 meters and so on. But what is happening in the joints? Actually, they are being damaged. The bones are rubbing against one another. So I can say that painkillers promote the progression of arthritis. And if you do not take the painkillers and you change your living and you change basically your thought patterns, which are the basis of healing, right thinking and right living, basically there'll be a reversal of the condition. But if you go under painkillers, there'll be a progression of arthritis, because what you're going to do basically is that you're going to misuse your joints, and through that misuse, you're going to destroy your joints. So progressively, you'll damage your joints, and progressively, you'll be a candidate for joint replacement very fast. So it will be much better to use natural painkillers. They are oils which you can be able to massage on your joints, and these ones will not actually affect, say, your mucosal membrane, promote ulceration. Similarly, you need to go slow. Stop using your joints. Basically, do simple exercises for them so that they don't become stiff. But prolonged use leads to progression of arthritis. So most of the damaged joints are due to overuse of anti-inflammatory products, injections, and painkillers. Thank you very much.